Do chronic hives look different in different skin tones? You bet they do. And that can make diagnosis a real challenge. In today's episode, we talk about urticaria, hives, in skin of color, and the challenges patients face with delays in diagnosis and treatment. We'll cover everything from how to capture good pictures of your hives to finding the right doctor for you. So if you've ever felt unseen or misunderstood with your diagnosis, this is for you. This episode is produced in partnership with the Allergy and Asthma Network, and we want to thank Genentech for sponsoring this episode. You're listening to The Itch, a podcast exploring all things allergy, asthma, and immunology.
Today, we're going to talk about chronic spontaneous urticaria in skin of color. And we have a very special guest, Dr. Alexis, who is also in New York City and a good friend. So, could you introduce yourself?
Absolutely. Good morning. My name is Dr. Alexis. I'm a double board certified allergist, immunologist, and I practice here in New York City. Thank you so much for inviting me today.
So we're talking about chronic spontaneous urticaria in skin of color. And before we launch into it, let's just get a quick definition of what chronic spontaneous urticaria is. We aren't going to go fully into it because we have a whole series about chronic spontaneous urticaria. So if you're looking to get a deep dive, you can check those out and we'll link them in the show notes. But just so we know, what is chronic spontaneous urticaria? Because I know it is a medical diagnosis that goes by a few other names as well.
Yeah, so I can take that. So chronic spontaneous urticaria, we've talked about it a lot, is essentially urticaria or hives that last for longer than 6 weeks. And we don't have an identifiable cause for those hives. And so essentially they are present maybe on a daily basis, maybe on an every other day basis, but they're chronic in the sense that they've been there for longer than 6 weeks. So if you want more information, definitely, as Courtney mentioned, we have a whole series that goes through chronic spontaneous urticaria.
And one quick question, because I know that someone just messaged us on Instagram and they asked, is chronic idiopathic urticaria the same thing?
That's a great question. We used to call it chronic idiopathic urticaria, meaning we don't know what it comes from. We just changed the name of the disease state. Now it's chronic spontaneous urticaria. It's still the same disease state. Still, you have to have almost daily hives for 6 weeks or so.
Great. Thank you.
So today, though, we're going to focus on chronic spontaneous urticaria in skin of color. The reason that we're talking about chronic spontaneous urticaria in skin of color is because we know that the diagnosis of urticaria can be delayed because a lot of providers, a lot of patients will get confused about what they have because the images that they find online don't really depict what they're going through, because we just don't have as many images of urticaria in people of skin of color. And so we want to draw special attention to that because we want to make sure that patients understand that their urticaria may present in different ways depending on how much pigment they have in their skin. And so can you tell us a little bit about what the differences may be in lighter skin versus darker skin with urticaria?
Yeah, absolutely. So overall, when you have the urticaria, there is some redness or some erythema that is present and some elevation. Now, if you add pigment or melanin to your skin color and then add the color red, sometimes the melanin overshadows the color red. So you may not be able to appreciate the redness, even though it might be there. It might be masked by melanin, which makes it a little bit harder to diagnose. Now, if you try to capture hives by taking pictures, you now have elevation that sometimes can be hard to capture. And with the hives, there's no redness. So taking pictures itself of the disease state might be a little bit more challenging. So then the classic situation, you go to the doctor's office and that day you don't have any hives. So it's tricky to start off with. And then if you want to show pictures, it makes it even harder because it's really a little challenging to capture both the elevation and the masking of erythema on film.
Do you think it's worth actually just taking a video of your skin instead of pictures at this point, now that everyone kind of has a video camera in their pocket?
Absolutely. Absolutely. However you can capture it, and you can capture it, it may just take a little bit more time. You may use sidelining to really show the differences a little bit more. And what's interesting with hives in general, they can look very heterogeneous. Just hives in any patient can present in a lot of different ways. You can have really small hives, and a lot of them can have really big hives. You can have a little bit of elevation or a lot of elevation, and you can have involvement of your face, your trunk, your arms, your legs. So they can appear in many different ways. And if you add a layer of pigment to it, it can make it a little bit more challenging to recognize hives.
And we've also talked about the erythema or the redness showing up as almost like a purplish discoloration as opposed to a reddish discoloration, what they call violaceous or again, purple hue. So that's also something to keep in mind.
Absolutely. So I just want to echo one more time, like most of our patients will try to Google their disease state. And if you just put hives in the Google search engine for images, all you see will be hives in patients with lighter skin tones. So then the question arises, is what I have very unique and nobody else has it? Or do we just not have the pictures?
I haven't personally tried this, but I'm assuming that maybe Google will get smarter if you put in something like hives in skin of color or hives brown skin, hives black skin, and maybe we'll get more appropriate images coming up that way.
That's correct.
And just a quick question. So, as a patient, you're Googling this and perhaps you're not finding the right images. How about doctors? Has that changed? Have they always seen just one type of hive, or have they been able to see a presentation of hives in all different colors of skin?
That is a good question. That has only recently changed. Until recently, there was a lack of diverse skin tones in most dermatologic disease states. So in most disease states that involve the skin or rashes, we only saw these rashes in lighter skin tones, and that includes hives. So yes, we see it in the lay literature and also in the medical literature or publications.
So everyone's starting to get smarter about how we're teaching our medical professionals and also what we're having available for patients. And that's why the Allergy and Asthma Network is putting together this initiative to really put an emphasis and to try to provide resources to patients with skin of color.
It's exciting to see what's going to come up in 2025 for chronic urticaria and skin of color. I know that there are going to be a lot more resources from AAN coming up. And we had a patient interview with Amika, which is probably going to air after this. So if you want to hear a patient experience, listen after this. But Amika is going to share a little bit more about her experience as someone with chronic urticaria and skin of color. And I know that she talked a little bit about her diagnosis process, and hearing that what doctors were trained on wasn't very diverse. Is there a lack of diagnosis for patients who have CU in skin of color, chronic urticaria?
That's really an excellent question. So we like to practice evidence-based medicine. So if you research what we have in the literature about patients with skin of color, specifically in chronic spontaneous urticaria, there isn't a lot of data out there. If you research the same disease state, for example, in atopic dermatitis, there is a ton of disease state. There's prevalence, so how often do patients with skin of color get atopic dermatitis? How long does it take them to see a specialist? How often do they go to the ER versus their pediatrician? What kind of different medications do they get? How many patients of color were in studies? So there's a ton of data out there for patients with atopic dermatitis and skin of color, but there's not a lot of data out there in patients who have chronic spontaneous urticaria in patients with skin of color.
But I think we can make a generalization, right, Emma, that the diagnosis is often delayed for all skin disorders in patients with skin of color because of the lack of training and because there aren't as many good resources for patients with skin of color.
So in my personal experience in the last 14 years, so anecdotally speaking, I can say that there's often a delay in patients either seeing a specialist or being diagnosed or actually being offered different treatment options or all the options that we have for their chronic hives.
And then what does it mean for patients that have chronic spontaneous urticaria if their diagnosis is delayed?
Well, it affects them personally, as we know, chronic hives. So you have little mosquito bites all over your body constantly. So you're constantly itching. They come and go. And depending on what you do, it may or may not get better. It may not or may not resolve with daily antihistamines. It may affect you professionally because now you're not sleeping well at night. You're constantly tired. You can't focus. You're scratching during the day. And depending on your disease state, 50% may develop swelling as well. So maybe you get swelling of your ears, your eyes, your lips, your palms and soles during the workspace. So it's professional, it's personal, and it's interpersonal too. It may affect your relationships as well. So it's a huge disease burden.
Yeah. So the earlier you diagnose it, the earlier you're able to get on treatment. That's going to be helpful. And the earlier you're going to have relief, right, from these symptoms. And so that's why early diagnosis is really important. And having a delayed diagnosis can really impact someone's journey in any disease process. So once they are diagnosed, I understand that there's also potentially a delay in the therapeutic options that they're given to resolve their symptoms.
That is correct. There's actually a study that was published about 2 years ago that showed that patients with skin of color are less likely to be given omalizumab, which is also Xolair, to treat chronic urticaria.
And we know that Xolair is reserved for patients that don't respond to oral antihistamines up to 4 times the dose. And so if they're not given that option, then they're again just suffering with the symptoms for a longer period of time and not getting resolution of their symptoms, which means it's a vicious cycle of just having to deal with the symptoms and have it affect all of those different factors that you talked about: interpersonal, work, life, quality of life measures. And so that's why, again, it's so important to get to the diagnosis, but then also to be given appropriate treatment options.
And what I would like to add to what you just said, some of the antihistamines are over the counter, not all of them can be prescribed. So then if you have to take, let's say, 4 times the daily dose of Zyrtec on a daily basis, not monthly basis, or even yearly basis, that can really add up.
Absolutely. The cost of all of these medications, and especially when a medication is technically over the counter, so insurance doesn't want to cover it and doesn't want to pay for it, that makes it even more challenging for patients with a condition like chronic spontaneous urticaria, because then really everything is coming out of pocket. So that's a really good point.
That's really interesting. So if a patient is diagnosed with chronic spontaneous urticaria and their treatment therapy, they really do well with antihistamines, but they have to take a lot, is there any way that insurance covers that? Or is that all on you because it is an over-the-counter medication?
That really depends on your insurance, and every insurance is different. And they may change that every 6 months. So it can get very frustrating and a little bit complicated as well. And as you know, there are different antihistamines. So they may cover, let's say, the tyrosine, but not levothyroxine, or they may cover fexofenadine. And again, that may change from every 6 months. So it can become a little bit complicated and expensive.
And again, it's really important because as a healthcare provider, we actually don't know if the medication didn't get covered by your insurance or if you ended up having to pay for it out of pocket. So if you want us to try for a different antihistamine, or if the pharmacist said, oh, if they prescribed this one, it could have been covered by your insurance, coming back with that information at your next appointment is super helpful, because then we can give it a try. It may work for your hives, and having it covered by your insurance is obviously better for your ability to be able to take it long term.
Absolutely. Yeah, I can only echo that sentiment.
Yeah, I think a lot of times patients don't realize that there's a huge disconnect between once we send the prescription over to the pharmacy, we don't get insight onto whether the person has picked it up, whether it was covered, whether it was really a high copay. We really don't have that information. So getting that feedback from patients is very important.
And to add to that one more time, some insurance actually pay for double the dose of antihistamines. And again, we don't know that until we prescribe it and then you tell us this worked or it didn't work. So work with your provider. It's really important to have a long-term, good working relationship with your provider.
It's interesting because I didn't realize that antihistamines could be covered since they are over the counter. And this is something that's really never come up in the podcast before, is working with your doctor to find an antihistamine that might be covered. So that's really good to note. Is there anything else that a patient can do to work with their provider on their diagnosis and on their treatment management plan that maybe they don't think about right off the bat?
The more educated the patient is about their disease state, the better for everyone. And it's a process. This is a chronic disease. So you should find someone that you're comfortable with and that can take the time to explain things to you. Ask questions, take notes before you come into the visit so you can talk about your disease state when you come in. Take notes during the visits, because as with everyone, there's a lot of information that's passed on from the provider to the patient, and you may not be able to capture everything in that setting. So take notes while you're at the doctor's office. And when you leave, again, take notes or ask questions or write them down once you have left. This is a long-term relationship because, as we know, chronic, you may have this disease state for 3 to 5 years and sometimes even longer. So you do want to work with a provider that you're comfortable with and can go back to and ask questions. The more you know about your disease state, the more empowering it is. And we now use shared decision making. So it's not the doctor making the decision for you, what we think is best for you, but we make the decision together. But to do that, the more you know, and the more we can explain to you, the better it is for both of us.
So I know in other episodes where we've talked about skin of color patients and things that we need to think about, research has come up often and the need for more diversity in the research studies themselves. Can you talk a little bit about that and also why it's so important?
Absolutely. So it turns out when medication is approved, it has to go through rigorous studies with lots of patients, and then we can see whether the medication works or not. It turns out in this case with omalizumab, the study was an international study, but a lot of patients were from Germany. So it turns out the inclusion of non-white patients was very low in that specific study. Now, that was published in the New England Journal of Medicine in 2013. We do know that omalizumab works in diverse skin populations. However, it would be great to include diverse patient populations in studies going forward because patients still ask, has this ever been tested on patients that look like me?
And we do know that different genetic predispositions can change the way that a medication responds. And so it might mean that the dose that we think somebody might be responsive to, it might need to be changed in people with skin of color. And so we just don't have that information. And so if somebody is not responsive and we just say, okay, they're not responsive, move on to the next thing, but then there isn't really anything to move on to, then we're kind of stuck between a rock and a hard place. And also, if we don't have the studies to show it, that we need to maybe use a higher dose or even a lower dose might have been effective, then the insurance companies won't actually approve the medication. So the way that the FDA approves the medication is based on the studies that are done. And if we don't have studies to show that maybe this population needs this dose or this population needs that dose, then we won't even be able to try different doses in different populations. So it's really during the study period that we can get that kind of information and knowledge that then we can use when we're prescribing.
Absolutely.
Because these studies aren't done on a diverse population, and as you mentioned, Dr. Alexis, some patients ask, has this been tried and has this been tested on someone like me? What kind of advice would you give those patients if they are working with a provider who isn't sensitive to a question like that or to that kind of concern?
That's a good question, and that can be very frustrating. I think omalizumab specifically, Zola, has been around for over 20 years. So we have a lot of data with this medication being on the market and being used in diverse patient populations. The way I see any chronic disease is that you are in a long-term relationship with your patients. And if you don't think you have good means of communication in that relationship, I think it might be worth exploring different options. You should always voice your concerns first and let the provider know that you have concerns and what your concerns are and have a conversation about that. If in any relationship you feel that you're not being seen or heard or understood, it may make sense to seek a second opinion or see another provider.
Yeah, we've talked about that a lot too, because it is just any kind of relationship is a relationship. And definitely the patient provider relationship is such an important one. So if you don't feel like it's going well, you shouldn't feel bad about finding another doctor that might fit better for your needs.
And what if I turn the tables and say, what can a doctor do to be more sensitive to patients with skin of color?
The complaint I hear most often is that the patient feel they weren't heard. So listening to your patient, I think, is really important for one. And then often when I ask patients who've seen other providers, so what's the diagnosis? They often don't have an answer. So in that patient-doctor relationship, I think it's very important to make sure your patient is heard and seen, but also to ask, so what is the diagnosis? What do I have? Rash isn't a diagnosis, right? Dermatitis in itself isn't a diagnosis. Ask questions. So what kind of rash? What kind of dermatitis? And if you don't feel you getting the answers, see a specialist.
Yeah. And just as a clarification, dermatitis literally just means inflammation of the skin. So, as Amma said, it's not an actual diagnosis, it's just a general term that we use to say that the skin looks inflamed or irritated. And yeah, I totally agree with that because a lot of patients will get confusing information where they don't actually have a name to their diagnosis. And sometimes it takes time to get a name to a diagnosis, and your provider is trying to figure that out with you based on more information that you gather, based on some testing that may need to be done. And so sometimes it does take time. And initially we just know that it's inflammation of the skin and that we really need to hone in on what might have caused that. And again, sometimes we never figure it out. And so it does just stay at that dermatitis of the skin. And if it resolves quickly, that's great. If it doesn't resolve quickly, then we really need to figure out what exactly is going on.
Just keep in mind that we're really trying to help you, which sometimes is really easy because it's something that we see all the time, and sometimes it can be more challenging. if it presents differently or something that we don't see all of.
That's really good advice. I think that sometimes as a patient, you're not sure what a good relationship is necessarily or what a bad relationship is with your doctor because sometimes it takes you 4 months to even get to see that doctor. So you're just grateful you got that 15-minute slot. And so you'll take whatever you get. So just to know kind of what's appropriate disappointment and what's not appropriate disappointment when you leave that office visit. I know that sounds really negative, but sometimes you can leave and you feel like, I just waited 4 months for that. And now I feel like I'm more confused than ever. Or, okay, now I'm at least on some sort of path and I need to hone in on what the right path is at this point. Does that make sense?
I think the answer to that question can be different for any patient. It depends on what you come in looking for. Do you already know what diagnosis you have? Have you had that diagnosis for a long time? Are you on a good treatment regimen? You just don't want to take medication long term. I think that answer is different for any patient who comes in. But again, as I said before, it's a relationship. So you should feel comfortable expressing your wishes. So when you go into the office, what is your primary goal? Why are you coming into the office that day? To get a diagnosis, to get therapy for a long-term prognosis? I think that answer is different for every patient.
Absolutely. And I think it just goes back to good communication and making sure that you have your questions written down ahead of time. And that if you leave after and you think of even more questions, that then you can schedule a follow-up telemedicine appointment even to go over those follow-up questions. I think it's just making sure that those communication lines are open in whatever way. And then if it feels like you're coming to a dead end and it feels like you're not getting the answers that you need or in the way that you want them, then I think it's appropriate to definitely look for a new provider at any time.
So I have a question. Let me start with a story. So my grandma's in the hospital, and I don't know if anyone knows this because you don't really see us on video. It's just new, but I'm half Chinese. And so my grandma's Chinese, and she's in the hospital, and every Chinese doctor she has is fantastic. She loves them. Any Chinese nurse she has is fantastic. She loves them because she identifies with them and she feels some sort of connection with them. And because we're talking about a disease in skin of color, I'm just wondering if that's a similar thing. Is do patients feel more comfortable with providers that look like them? Also keep in mind my grandma is 90, so she's very old school when it comes to her doctor. Her doctor can tell her to like jump on her left foot and she'll do it. Her doctor is God in her mind. But I'm just curious because her experience is it's just so black and white with her in the hospital.
That's an interesting question and a great anecdote. In the perfect world, anybody should be able to treat any patient. And that's really our North Star, right? That's the goal. In reality, it turns out, I think, and that's just the way medicine is, you have experts in certain areas, and that's regardless of skincare, right? That's you have experts in melanoma, you have experts in hives, or experts in atopic dermatitis. So with that as a background, sometimes I think there are doctors who see a lot of patients with skin of color who are very comfortable seeing patients with skin of color, regardless of their skin tone. So it's a very nuanced question, and I think it's a very nuanced answer that you have experts in the medical field across the board, and some patients will seek out providers that look like them because there is literature out there that shows that patients being treated by providers that look like them may have a different relationship. But again, the North Star is really to be comfortable seeing any provider who's comfortable treating your disease state.
And I really like that idea of the North Star because as medical education is changing, that is what the goal is, that every doctor should understand the nuances in treating skin of color, patients of color, and have a good baseline education so that they are treating those patients the way that they need to be treated. And I think that that is the goal. And then until that point, sometimes I think finding somebody that you may relate to better. And again, that's really finding that patient doctor relationship. For some people, that's very important. I think for your 90-year-old grandma, Courtney, that it just makes sense to me. You know, she will feel more comfortable potentially. And that's not to say that every 90-year-old Chinese grandma feels more comfortable with Chinese people. It just depends on her experience, right? But it sounds like for your grandma, that's just what gives her comfort. It makes her feel like maybe her granddaughter or her grandson is taking care of her. And so we can't negate that that experience for people and that need, right? And so that's why it's just so important to listen to yourself and to understand what you need in a doctor-patient relationship. And that can vary depending on the condition that's being treated. So you might not need that heightened level of experience with every single doctor you're seeing, but if it's a chronic condition where you have to have a lot of contact with your doctor and you're having to navigate that relationship often, then maybe in those relationships, having that extra level of comfort is helpful.
Thank you. That's a really good thing to hear. I like this idea of North Star. And yeah, I think that it is something comforting for my grandma because it's also a cultural thing with these doctors as well. They understand her cultural needs.
So I think we covered a lot of really important topics today and really just got into the concept of what are the things that patients and even providers need to think about in people with skin of color and a chronic skin condition like chronic spontaneous urticaria. So Amma, we always like to leave our guests with the opportunity of giving your parting thoughts on anything that you want our listeners to remember.
So first of all, I'd like to thank you for inviting me today on your podcast. It was great. So there are two things that are very important to me. I think having a great working relationship with your patient and using shared decision making. So it is not us, the medical providers, telling you what to do and what's best for you, but as in every relationship, we decide together what's best for you. It's our role to educate you and guide you what we think would work best for you, but it is really through shared decision making where we both decide what's best for you that we have the best outcomes. And I think also the best adherence. So having a great relationship with your provider, I think is very important.
Thank you so much, Emma. Yeah, we talk a lot about shared decision making on the podcast. And I think in this context, it's really important to just be on the same page and to make sure that you feel seen and heard. So thanks again for being on the podcast and for taking the time out of your super busy day. We really appreciate you.
Thank you.
Thank you so much. Dankeschön.
Bitteschön. Tschüss.
Tschüss. That's like a little insider German joke because Dr. Alexis is German. The end.
Thank you for listening to today's episode. Remember that all information you hear today is for informational purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. And also, don't forget to subscribe to our podcast. And if you have a second, help spread the word by rating our podcast and sharing with your friends and family who might also be interested in learning more about allergies, asthma, and immunology. You can always stay up to date by checking out our Instagram, The Itch Podcast, where you can leave questions you are itching to know, or check out our website, which is www.itchpodcast.com, which contains more information about the subjects we covered in today's episode and every episode. Until next time, have a fabulous week.